Now Jordan has ADHD, and I think what's quite remarkable about that film is that he was able to ask the questions he did. What are you doing? What's this stuff? What are you going to do when you're older? The dialogue between the two children is quite remarkable. For staff, much more relaxed. And what is the potential for learning once you can get staff stress and pupil stress down to those kind of levels? So I'm just going to, I then measured them. I need to go back into the PowerPoint now. So I did a similar kind of survey with these kids on anger and stress and energy and hedonic tone using the same scales. And this just really confirms some of the things that you witnessed in terms of mood change between those two settings in the school and the forest school. So if we look at anger, if we look at the school setting, which is the dotted line, over the day, pre-test, post-test, again over a day, we saw that anger shot up. In the forest setting, okay, they started at a different level. Arguably, they were looking forward to the forest, maybe their anger levels were, oh, actually their anger levels were higher that day. But over the forest setting, we saw a more significant change in the reduction in anger over the course of the day. Does that make sense? You can see that, I think, in the film. And we're saying exactly the same pattern on stress. These are kind of called perfect interaction diagrams, charts, which we do in environmental psychology, showing completely opposite effects in those two settings. And I did make a mistake in this study, and I'm wondering if you can detect from what I've said and shown you what that mistake was. It maybe not the obvious, but I didn't measure the staff on stress. And I think what you saw in that clip was the level of stress amongst those staff who were trying to teach a typical curriculum in a small confined space, and their levels of stress and their body language, and the staff outdoors who have a completely different kind of demeanour and mood. So if I was to repeat this, I think it would be very important to look at concordant levels of stress. What's happening with teacher physiology and stress, and how is that affecting the pupil's stress? And then I just compared the two settings. This is just a very simple chart to show you. Here are the kids in the mainstream school. Across the day in the forest, we saw changes, drops in their stress levels. It was, and this is a kind of perfect graduation chart. The good group, their stress levels dropped. The poor behaviour group, their stress levels dropped. But those kids who are really at the end of the spectrum of behaviour, their stress levels really significantly dropped over the course of that day. So I would love to try and replicate some of this work here. The context of the forest is very different here in Virginia, and we might talk about that. But that's one of my ambitions. And finally, this is really just a proposition study. I'm going to finish in about 5 minutes. I have another PhD in Scotland who finished this year, Amanda Neoy, and she was looking at blue light exposure mostly in older people over the age of 85 and 90 who have cognitive impairments. Now, blue light controls our circadian rhythms. Blue light is the sharp daylight of the outdoors. You can obtain it naturally, or you can obtain it through artificial bulbs. We all absolutely need exposure to blue light to cognitively function and to sleep, and it increases as we get older, which is why, or the need for it, sorry, increases as we get older because the lens of our eye yellows, and that lets less light through to the back of our eye. This diagram just explains what's going on there. So our eyes have this non-visual function, which I just find quite amazing. And at the back of our eye, we have these cells, and the blue light comes through the eye, and it triggers messages to our body clock, the SCN, which triggers our pineal gland and releases melatonin, which is our sleep hormone. So I'm not going to talk about most of her work in older people, but she did find incredibly low levels of blue light exposure in residential care settings for older people in Scotland. And again, the Scottish Government have really kind of bought into this research and are working with her now to try and develop this work. But this is a proposition really. So children with autism are prescribed melatonin to help with their sleep issues. So the proposition really is, would exposure to natural daylight outdoors improve their sleep symptoms? Now, she took this study only so far, and she developed a protocol using actigraph light watches. And the big challenge for these are teenagers, the big challenge in her study, protocol study, was really how to get them to wear the watch, because they're super sensitive to wearing anything. I don't know if anybody here has done any research with young people with autism, but she engaged them in the science of the study through charts, through storyboards, and they were absolutely fascinated to see their exposure levels to blue light across the day. She studied them over a week. But really, these are just her kind of proposition findings. So children with autism are particularly sensitive to fluorescent light and changes in light. Moving from one lighting environment to another lighting environment causes them real problems, because they have difficulty reading the cues in people's faces, and light changes can really alter their perception of how to read behaviour. And as I've already mentioned, there's disruption in the melatonin rhythms in children with autism that affects their sleep cycle. And really the gaps she identified in her review were that there's just no study quantifying the amount of blue light that is reaching the eye in these children with sleep problems. There's limited research on light therapy as a possible non-pharmaceutical intervention to synchronize circadian rhythms. And what she's working on now is a very simple light intervention to measure the effects of sleep on particularly teenagers she's interested in. So teenagers and blue light are quite an interesting area to study. There is evidence to show that lack of blue light in the morning can actually cause disruption to their sleep cycles, which is going to impact on their cognitive performance. But the big problem with our teens currently is blue light exposure from laptops and mobile phones in the evening. And these are just other kind of proposition studies that I'm interested in exploring here, and that Mandy is beginning to develop back in the UK now as a postdoc researcher. So I'm going to finish in a moment. So natural solutions are really, you might call them green prescriptions. They can be potentially alternatives for managing behaviour. The Chief Medical Officer of Scotland is very keen on this notion of green prescriptions. I'm a little wary of using medical terminology to describe our natural environment. Some of my work with patients with severe mental health problems indicates that actually what they love about the natural outdoors is it's an everyday experience, and it's the everyday experiences and access to environments that we can all fairly easily access that's really important to them. So medicalising the landscape, I'm not so sure about. But I picked up this quote at the weekend from the New York Times. There's a new book come out called ADHD Nation by Alan Schwartz, and this is a quote from a clinician in that book. We've decided as a society it's too expensive to modify the kid's environment, so we have to modify the kid. And this is relating to that increasing reliance upon prescriptions for managing behaviour. So what I'm interested in is how we modify the environment and how we use that environment to really manage some of these issues. And I hope what I've tried to demonstrate there is the incredible difference in mood and behaviour that you can see in a very extreme group of children with behavioural problems. Finally, this is my final slide. What do I want to do here at UVA? I'm really interested in exploring the convergence of environment with education, design of those settings, health and well-being, but also performance outcomes in schools. And I'm working with a group here that includes Patrick and Karen McGuthery in environmental science to really try and develop those ideas. And I'm particularly interested in really how that can build resilience, and how, for me, youth really is at the heart of community resilience and the effect that that might have on a community. And what I'd love to do is establish some sort of natural connection school demonstration project here, looking at the outdoor classroom, looking at how staff respond to that, looking at the physiology and the behaviour in that. So we have time now, we have half an hour for questions and debate and discussion. I'm very interested to get your feedback on this study. I mean, all this work's been done in Scotland. Just a note that I have to shoot off relatively quickly at 12:30. But this is my email, and I would really welcome collaboration and communication and further dialogue with you. And so thank you very much for listening.
So I had a question about the cognitive effects, so the cognitive recall effects.
Recall, yeah.
Yeah. So I'm curious about. I'm assuming that for these kids, the outdoor tasks were also more novel, that they didn't spend as much time outside. They weren't used to spending time outdoors in school or doing tasks outdoors. Am I right about that? Or
yeah, these are deprived city kids who don't have garden access particularly, so then there's a novelty value.
Yeah.
Certainly,
So I'm wondering
outdoors.
if you think the cognitive recall effects would hold if that became a more routine. So is it that they're just remembering what's
because of
novel, or is it that there's actually an effect of the nature in and of itself, even if they were doing that every day?
Yeah, so Jamie had 3 settings. So one was a schoolyard that was completely tarmacked over, so not a lot of novelty value in that.
Okay.
And then there was a schoolyard with raised beds with some plants, but not a lot. And then there was a much more, the setting that I showed you was much wilder. And what he showed, what I was trying to show in that chart, was that actually the recall seemed to be greater in the setting that was richer in nature. But, I mean, yes, this needs to be replicated and it needs to be done longitudinally. One of the problems, as I said, with longitudinal research is funding. Very difficult, but that's a really good question. Thank you.
Actually, the same. Yes, I was going to say nature versus novelty, but I wonder about, as a sort of follow-up, thinking about if you took those same kids and looked at an environment, say like maybe they went to another built environment, like a science museum or something, and they did the tasks there. I wonder how different. So it's something that's novel, but it's also not nature.
That's really interesting. So basically this boils down to the notion of fascination and curiosity, which is fundamentally at the heart of restorative environment theory. So I did say that other environments have restorative effects. Cafes, art galleries, museums, all can have that potential.
And so I had a similar, just I guess, thought or question about the differences between kids who are labeled as having the more problem behaviors. And it seems that potentially, in addition to the restorative effects of the environment, if they're being put into a novel environment where they don't necessarily have the same stigmas that are applied to them, they're able to kind of re-envision themselves in a different way and take on new roles. So thinking about the boys too, at the we're doing in the boys' school, that last study, it looked like perhaps when they were outside, they were doing things that were not sort of adult-driven, adult-controlled, try and sit passively, but they were more engaged, maybe some more opportunities for leadership. So I wonder too about, in addition to the positive benefits of being outdoors in nature, about the nature of the actual tasks that they're doing and the sort of ways in which they can kind of re-envision their identities.
But that's very insightful for 2 reasons, really. One is that the teacher perception of the child and their behaviour outdoors changed. But also using the video as a tool by which to capture some of the experience. So Jordan, the child with ADHD, behind the camera, took on a different personality, a control personality. He was in control of asking the questions. So that, I think, does that kind of...
Yeah. That's one thing that I sort of picked up on that, so they have this opportunity to kind of lessen that stigma that back into the school context, it's like I'm just seeing the same old way and there's no opportunity to kind of break out of that. Well, this is a really nice
really
part of that,
valuable outcome, definitely. Yeah, thank you. Other questions? Yeah, at the back.
So, would you comment on the independent effects of moving to a different environment versus the interaction and changes in physical activity? Because there are data that suggest as you become more active, you have better recall and better cognition, and you've now moved to an environment that promotes activity.
Yeah, so that's a very good question. I don't measure physical activity. I have worked with people who have measured that, who have shown a day at Forest School obviously increases your level of physical activity, and that is having a physiological effect. It's not my area of specialism, but yes, I can't account for that in my data because I didn't measure it and control for it in my statistics. So thank you for flagging that. It would be very important to measure that using accelerometers or however you might recommend that I might do it.
We've got some accelerometers.
Yes.
I have a question. You mentioned the idea that you wished you had measured the teachers.
Yes.
And on one hand, I see the teachers facing the challenge of, oh, I'm taking this group of kids outside and anything can happen because it's not a controlled environment. And on the other hand, the process of being outside for them, as well as seeing their kids in a more positive light because it's a more positive experience for them, might be kind of make them feel a little bit better. And I'm just curious about what you would measure and what kinds of things you think you would see in these teachers.
So one of the first things I would ask them is what was their exposure to the outdoors as a child themselves? I forgot to mention actually, but in terms of building community resilience, two things I'm really interested in is one is exposure to nature as a child. You're much more likely to behave in a pro-environmental way as you age. The other is that you're much more likely to take exercise outdoors, in parks, in forests, if you've been exposed to nature outdoors. So in terms of perhaps preparing teachers for an outdoor education program, I think it'd be very interesting to look at their kind of past autobiographies of nature experiences. How comfortable are they around nature? The two teachers who took Forest School in the residential school both felt super comfortable in that environment. You could tell that, you could see that. Whereas in the previous school, the mainstream school, the teachers were not comfortable at all. So I think it's really important that these types of programs are initiated by people who either believe in the power of nature or are willing to be kind of shown the evidence that it can really change and improve the teaching experience as well as improving the kind of behavioural outcomes. There's a wonderful nursery school in Scotland, it's called The Secret Garden. You can go onto YouTube and put it in. And these kids are aged sort of 3 to 5. It's one of the highest achieving nursery schools in Scotland, and the kids are outdoors all day long. They have a teepee for when the weather gets really, really bad. But the teacher, it's really fascinating because the teacher interaction is really minimal. They use walkie-talkies and they talk very quietly, and the children undertake these massive projects in terms of building and constructing things, and they work as teams. And they only go there perhaps 1 or 2 days a week, but the effects are really quite extraordinary. And that's what I'm really interested in, exposure to that kind of experience as a child, how that builds resilience, not only individual resilience, but how that can build community resilience as well, further down the line as you get older. Other questions? Yeah.
I'm curious about your thoughts on sort of how this could translate to traditional schools. So do you think you're showing examples where students are getting all day in these outdoor and wild settings?
Yeah.
But I mean, do you think that for the natural learning schools I've been in, they just give you sort of 15-minute little bits of outdoor exposure where the kids can run wild in a outdoor setting, and then they come back to a more traditional classroom, and that seems to help. I mean, do you see that as sort of the same thing, or do you see these all-day programs as different in some meaningful way?
No, well, that's a really good question. So if I go back to this slide of the school here, it's a long way.
Right.
And this castle has courtyards. And what I was really keen to do with the school was really establish whether we couldn't use those courtyards for breathing space, because these kids are, their behaviour is exploding on a fairly regular basis. There isn't time to walk down to Forest School. So I'm all for integrating green infrastructure into the school setting. And what we don't really know about my field is what scale, how much do you actually need to make a difference? But I do believe, kind of intuitively, that small courtyards in a school such as this could really help manage behavioural problems. Thank you for mentioning that. Yeah.
Did you take any measures from the parents? Is there any feedback for mood, sleeping patterns? Or are they more angry about the muddy clothes when they come home?
So that's a really good question too. In this school, the parents were not present. So these kids, their only hope of rehabilitation back into society is foster parenting. In the mainstream school, we had to obviously get ethics approval from the parents. And I did ask if I could do a survey on parents, but I was denied access to those parents. This is, again, a very deprived inner city school in Glasgow. So I think the school has a sufficient difficulty engaging with the parents anyway, let alone a researcher coming along and doing a questionnaire. But it would be very interesting and essential to monitor, particularly in relation to blue light, if we were going to do a natural lighting study, what the effect of sleep was. But although we can use the actigraph watches to capture that. What was interesting in Mandy's study was she did develop this protocol in a residential school, and when the kids went back home at the weekend, so they were there at the residential school Monday to Friday, very steady routine. So many hours doing this and so many hours doing that, and restricted access to blue light and technology in the evening. Their sleep patterns are very good. When they went back home, their sleep patterns and their daylight exposure was all over the place, which is also quite awkward to manage in relation to parental contact, and yeah, there's some ethical issues there. Okay, other questions? The back, I think you were first, yeah.
So one model for developing interventions in this way is to identify the root causes and sort of try to develop an intervention that affects those root causes. Right? Do you think that indoor settings somehow cause behavior problems or stress levels or anger to rise? Or is this just something that happens to lower those?
I think indoor settings can be designed in such a way as to not cause those problems, and I think access to daylight is absolutely critical. So whenever I walk into an office, wherever it be, and there's no window, I immediately have concerns for the well-being of people working in that place. So I hope that isn't anybody here. Well, I can help you put a case together. But I think what's really important is the interaction of the two. And for me, it's a no-brainer. Why wouldn't you want to bring some of nature into the classroom? Where it's very difficult sometimes in a controlled hospital setting, what works very successfully is if you bring in imagery of nature. And in prison environments, there's a really fascinating study that's just come out looking at nature imagery in prisons and how that reduces tension. Again, if you can start to reduce tension in a prison environment, how much more does that make that a reasonable place to be in 24/7? So, yeah, interesting questions. Thank you. And there was one at the back, I think.
I was just wondering if you could talk about the type of tasks that they were doing in each setting, because it seemed as though when the setting changed, the type of task changed from sort of more teacher-directed to kind of more student-directed in the natural environment.
It wasn't particularly. So the task was making a toy that I illustrated. So they had a random range of materials indoors. Okay, not soft, natural materials. They weren't particularly supervised, okay? They had the option of working in teams in the classroom. They chose not to do that. Jamie did actually plot it, but it's such a nightmare of a diagram to show. I decided not to show it because the interactions outdoors were quite extraordinary. because there's more space, you know, I mean, that there are obvious reasons why that might have been, but the tasks were really carefully discussed with the teachers to try and be as comparable as possible, but also to fit into their curriculum. Yes.
Particularly with incorporating what you've talked about here into traditional classroom settings and just taking kids out for periods of time, do you have any thoughts on how to limit the stressful side of keeping them safe?
Well, I think if you have a playground, why not just green it up? It doesn't have to be a big space. It doesn't have to be complicated. You can use raised planters. You don't have to dig down. I've done this myself. When my own kids were at school, I went in and greened it up. And I don't think it needs to be that complicated to make an improvement, really. Other questions? Yes.
Can you talk about the curriculum of the forest school and for this residential school, and whether the curriculum is similar to the kinds of things they're learning inside?
That's a good question. So the curriculum for forest school is very similar, and it includes a proportion of time spent on what are called structured activities and unstructured activities. So a structured activity might mean collecting berries, making a paste, doing some kind of creative experiment with that paste or something, building a structure, or cooking, or learning about fungi, or using that environment to do some basic kind of biology. But always built into forest school is a period of unstructured time where you can just roam free. Some of you might have heard of Richard Lou's book, The Last Child in the Woods. Richard Louw is a very, very clever man and made a lot of money from turning people like myself's research into accessible stories. And he wrote this book, which is really about children who don't have access to the outdoors. And he coined this term nature deficit disorder, i.e. we're actually doing harm to our children and our future generation if we don't expose them to nature.
So I was wondering if you heard about, this is just thinking about, I've been thinking about links between your work and other things, and I was wondering if you knew about like the Outward Bound program in the US. So I was thinking about connections between sort of your work, and I actually don't know if there's research on Outward Bound, but also some of the research on summer camps and summertime use in the US might be interesting, because it might have links to kind of what you're doing in terms of thinking about the effects of out of school time nature programs, whether they be summer camp or.
So that's great. So Kaplan and Kaplan, who I mentioned, developed this theory. They actually started their research in a outward bound, experimental kind of wilderness setting. And it's a very specialist field, I think. And whilst I'm interested in it, I've always been somebody who really wants to embed my research in building opportunities for kids who live in deprived environments and making this accessible to everybody. And certainly in the UK, we have Duke of Edinburgh, which is an outward bound program, and it's the kind of upper end schools, the private schools, who tend to be able to offer it.
So I think that, because there's been some work with outward bound. I know in my school, it wasn't an outward bound, but it was kind of based on that. But it was actually originally intended for the kids who were sort of at risk for dropping out of school. And they ended up expanding it so that other kids could do it, but it actually was seen as more like an intervention, and that other kids didn't have access to it. So I don't know if that's true in other places in the US or not, but
I don't know, but that would be very interesting to explore. So thank you for that tip. I think Patrick, you had a question?
Well, I have two questions. So the first question is, given that more and more of the world is urban, how would you be thinking about this work in terms of urban landscapes? How would you be thinking about this kind of work? That's question one.
That's question one. Okay, I'll answer that first.
Let's do that and then we'll go to question.
Okay, so have you heard of Biophilic Design? Anybody? heard of biophilic design? So biophilia tends to refer to our innate connection to nature. So biophilic design is very simply green architecture. It's architecture that has green walls, green roofs, courtyards embedded into it. So Chicago, who likes Chicago? Chicago is literally preparing itself for the flood. It has ripped up its roofs and put down green roofs. It has ripped up its paving and put down sustainable paving. It has wonderful parks. So it's a great example of a green city that has this biophilic structure and retrofit approach as to opposing, as to building new. So difficult in schools sometimes maybe to do that. It's costly, it requires maintenance, it requires people who know what they're doing. But I think that's the solution in our urban cities. Again, a city like Singapore, I've not been to Singapore, but I look at pictures of Singapore and it looks extraordinary in terms of its biophilic design. It's a biophilic city. Who's heard of Tim Beatley's biophilic cities? Tim Beatley is a professor, a very well-known author in biophilic cities, and he runs this, he's a professor in planning in the architecture school, runs this group called Biophilic Cities, one of which is Singapore. I think Portland's another, Birmingham in the UK is another one. So have a look at biophilic cities if you're interested in how to bring green into the city.
So that, because that's sort of part of the second question, which is, if I was thinking about this along with the strain that Art commented on, which is having people do more engagement in physical activity and other things that might improve their and engagement with nature as a subject matter and experience. There's also this big movement towards having schools be green, not just like not low footprint, but also kids learning is done within an environment where they're made aware of the environmental interdependencies. And then the second thing is this major trend towards trying to reconnect kids to where food comes from and how they get fed in gardening and things like that. So just how would you think about your work relating to those two kinds of activities? Educational trends, I guess, or
so will they converge, obviously, those things, and urban food growing programs are going to have an impact on nutrition and obesity outcomes. I haven't measured those in the past. That's not to say that I'm not interested in measuring those, but I really am a mind specialist, so I'm really interested in how we unpick all of this. Very difficult to unpick all these different variables and really show causal effects of one thing impacting on another, and we haven't done that in my field yet. We need statisticians, we need structural equation modelling, things that I don't know how to do. So to answer your question, the only way we're going to get there is by collaboration and multidisciplinary research, and people like myself working with people like you and people in physical activity and engineering and the statisticians to build the models to control for the variables.
Well, that seems like a good place to end.